I'm Dr. Dave Moylan. Welcome to Modern Medicine, and our topic today is a continuation of our educational presentation on narcotic drug use in Northeast Pennsylvania. Our guest is Mr. Jim Nettles of the Foster Township Police Department. Jim, welcome to Modern Medicine.
Thank you, Doctor.
What we had been talking about in the recent past was the history of narcotic use in the United States, but going back to its roots in the Far East. And we saw that there was a French connection with narcotics coming through Marseille and ending up in New York City. That was broken up in the 70s, but a new horror has started. Can you bring us up to date on that?
Yes, after the French and U.S. drug agents dismantled the French connection, which ended the mafia's reign on the heroin into the United States, then came the Colombians, and that began a whole new chapter in the drug itself. And again, the biggest producer of the heroin is Afghanistan, is basically 87% of all the heroin produced in the entire world comes from that particular country. And heroin can be purchased in 700-gram units for $7,500 to about $9,500, and sold in the United States for $60,000 to $70,000. Because you can see the profit here, and those that want to get involved in this type of activity, there's money to be made with these individuals.
So I'm just doing the math. It's probably about a pound or so of the raw drug, and it could be sold in this country at 10 times profit of what the trafficker bought it for.
That's correct. And a lot of time, and here's a known fact that we all hear this word, and everybody uses it. Support their drug habits. A lot of people users in the East Coast cities, New York and Philadelphia especially, they would often go around and collect and sell scrap metal. And as a result, the people they gave them the name junkies for going around picking up the junk and selling it to support their habits.
Well, that's quite a picture of a transformation, I guess, on
Yes,
a
it
junkie.
is.
Huh?
That's a young man that shows him in 2000, and also shows what happened 7 years later with the drug in his system.
Well, maybe we could depart here and just talk about this aspect of law enforcement in Schuylkill County or Northeast Pennsylvania. And I know there's plenty of metal dealers around. How do you go about investigating these crimes of theft of precious or of scrap metals? And fill us in on that, Jim.
Well, that seems to be a big problem here in Schuylkill County. As you know, you probably read the paper many times where homes have been broken into and copper pipes have been stolen. Yeah. Or individuals that have various metals and so forth around their properties. These individuals drive around and they look at these places, and if they see a home that they feel there's no one there, they can go in and actually strip that home in a matter of an hour or so of all the copper pipes. And they take it to a local scrap metal place and they sell it. So we still have the junkies. It's just they're homegrown junkies, that I would call them. Then they deal a lot with your copper pipes, and there's been several homes where the people come home, people have been away, they come home and they find all their copper pipes or the basements flooded. Yep. But it is and the police departments are being more cautious with it, asking people when they do go away, contact the police departments and tell them that do a house check, or who should be there in those particular areas.
Do you have special relationships with the metal dealers?
We try to. We go back and forth to a lot of the dealers. If we do have a large amount of copper or whatever that's been stolen, we do reach out to the particular scrap yards and try to get an idea there who is selling these. They're supposed to ask for ID if you come in, and hopefully they do keep a record of who is coming in selling that, and that gives us somewhere to look for on who's bringing in a lot of these scrap metal.
Great.
Another area that I know you're right now with your position, you see a lot of this. And heroin overdoses basically has caused more deaths in traffic accidents than past several years. And over 80% of the heroin users inject with a partner. There's always someone around them.
Yes.
And as going out to these death investigations, yet about 80% of the overdose victims found by police, EMTs, are found alone. So there's always going to be a partner there. And when they're conducting their investigations, this should be in the background, realizing that there are always going to be somebody
was
there
probably a
that
witness
saw
there,
this,
yeah.
witnessed this fact, or maybe even injected the person.
Jim, along those lines, we're always looking for a way of bringing closure to the family members, because even though they're junkies, they're somebody's loved one, that's for sure. And what are your perspectives on enforcement being able to get a perpetrator or a partner or something that somehow caused this unnecessary death and get some justice here?
With the investigation of introducing a drug to a person who eventually takes their life, it's a complicated investigation. I mean, there's a lot that you got to put together, or your probable cause, to build up probable cause to show that this particular drug came from this particular individual, and this is the same drug that was introduced into this body. There's a lot of connections there that you got to make, and it's difficult, and it's frustrating, both for the police department and also for your pathologists and also for your coroner investigators, trying to put this together, because you know it's out there, but it just matching everything together to get that proper ingredients.
And people just don't come forward?
No, because most of them that you see are drug dependent themselves, and they don't want to give up that
life.
Right, exactly.
Okay. Now, what happens physiologically when somebody injects themselves with?
Well, basically, with
like
the heroin influence, begins at the point of injection, and it continues up to about 4 to 6 hours within the body, and the puber size contractions last about 4 to 6 hours. Basically, what they say is do a lot of photographic documentation of puber size, whether alive or dead in some situations. And injections, here's an interesting fact. It takes about approximately 50 injections to form 1 inch of a permanent scar tissue on a body. That's a lot of injections.
Sure it is.
When you measure that when you're doing your investigations.
I know that when we're doing pathologic analysis, the pathologist will often excise that area, say in the antecubital fossa, look at it under the microscope to try to get it scientifically nailed down. Well, Jim, we're going to take another break, and we'll come back to continue this interesting discussion. Welcome back to Modern Medicine. Our topic today is drug problems, the killer, the silent killer. And specifically, we're focusing in on heroin and heroin that's been laced with fentanyl. Our guest is Jim Nettles, who's going to continue this fascinating discussion. Jim, it seems that heroin addicts, they have a vocabulary all their own.
That's correct. I mean, their communications to one another, to an ordinary person, you're not going to pick it up unless you're into that type of activities. And as we were talking about before, is about the injections. How long it takes 50 injections to form 1 scar onto your body. So you realize that this person had 50 injections already to form 1 scar. And when they do inject, you do, after a small fix, you have a pink swelling that occurs at the site. And how long that pink swelling stays, I don't know. But the scab forms within 24 hours and lasts as long as 21 days. And when you ingest intravenously, it takes 10 seconds of this drug to reach the brain. And how do they go about preparing this? Well, usually these individuals, they put their drug into what they call a cooker. Could be a spoon, bottle cap, anything that's going to hold water. They use whatever kind of heat source they can, a match, a lighter, whatever. They heat it, then they place in a hypodermic needle, and then use the cotton ball to strain it, to shoot it through. And some of them injected directly into their arms, and then other ones would use the process called booting. And booting is nothing more than drawing blood back into the syringe, mixing it back up, and shooting it back into the body. To
get every last molecule of the drug into the system, pretty much.
That's correct.
And when you talked about the pink wheel that develops at the injection site, I think that could be related to histamine, because people that are getting morphine intravenously, say during a heart attack where you want to just cut down the chest pain, you will often see a pink streak sitting right on top of the vein, and that's believed to be release of histamine. So that's probably a pharmacologic effect there. And again, you were talking about the cotton balls. These are clues that police officers, deputy coroners need to be mindful of when they're on the scene, because you go there and there's a death and there's some cotton balls around, what do you think?
Yes, and there's many other articles here that we're going to be talking about that you should be looking for when you go to these scenes. And some of the effects that these individuals are going to get is you get a rush. E4 can replace thoughts of food and sex, substitute for sex with these drugs. You get a high, basically, feeling of well-being. You must take more. You want more. And the nod, you're out of it and not aware of your surroundings. And then being straight, basically what they're talking about there is feeling when not sick. You're just taking the drug and it's not really affecting you in that manner. And one of the things we talk about is the homeostatic body functions. These are the functions that we deal with every day. It's that the body temperature, dilution of these blood vessels when it goes into the blood system. Retain the fluids, which what happens there, you get constipation. And dilution of the pupils, wearing sunglasses. And side effect, depresses respiratory centers in the brain. And then you have the overdose, which is the respiratory arrest, death due to the lack of oxygen to the brain. So there's a lot going on when they inject that particular drug into their system, when it only takes so many seconds to hit the brain.
Just some medical commentary on what you're pointing out there, the constipation. Again, patients that are taking narcotic analgesics for cancer pain, that is one of the big bugaboos. They all get constipated. So I will routinely start them on a drug such as Senecot or Seneplus. These are propulsive laxatives that reverse that sleeping effect. Again, morphine, the god of sleep, it puts the bowels to sleep. So you need a special type of laxative. Some of the ordinary laxatives that you might have results with, such as milk of magnesia or fiber, it distends and bloats the bowel, but it doesn't stimulate it. So a special type of constipation here with narcotics. And the other is the respiratory depression, the respiratory arrest. At post-mortem examination, we'll see the lungs filling up with fluid. So I'm thinking that as opposed to the effects on the heart, where there might be a rapid death, the respiratory death that we see with narcotics is a slower process to allow that fluid to accumulate.
One of the other influences with one of the drugs is you have when you're looking at a drug site where the injection site is, you have blue dots on the skin. And basically this is caused by attempts to sterilize the needle with a match. And with that you have carbon deposits that under the skin is called tattooing when they inject it. And you check for rash or hives withdraw because they have a tendency to scratch themselves and get hives when they start going through withdrawal, when they're trying to, when they don't have that particular drug going through the system. But you can see the tattooing on the body, and it stays there for a period of time.
Again, another clue for the investigators.
And just like you mentioned before, the adulterants that basically are also in the particular product, that leaves the hard, very hard lump underneath the skin. Some of the indicators, signs and symptoms of an opiate use, you have poor coordination, drowsiness, sleepiness, dry mouth, appearance, your clothing, as you saw in the one photo, malnutrition, pupils of the eyes, sunglasses, droopy eyelids, flushed complexion, and scratch-faced areas, nose, and sweating. Again, from the going through the system to the withdrawal.
The pharmacologic effects of the drugs.
This basically is just a photo of what all the heroin does to all the organs and
composite showing the ravages of the disease. It's how the campaigns for tobacco, showing a lung filled with tar. We need to get this out, and I know that you've been part of education at the high school level, but just for the young people to see how this destroys them.
Yes, definitely. Definitely. They don't realize what all that drug does to your body. And another thing, and I know in your profession you probably see this quite a bit, is that excessive desire for sugar from these heroin addicts. Because a lot of this mild sugar is diluted in the heroin, and this causes high glycemia, and which is the milk sugar habit. And milk sugar habit, you see the bad teeth. And that seems to be, you see this quite often. And impaired comprehension, long sleeve shirts from hiding the needle marks, tracks, and possession of prescription drugs, tie rag, teeth marks at one end. What does that mean? That means that when they're putting this into their drug, they're using their mouth to tie that, hold it in place
Tourniquet.
while they inject it. And also, don't forget that you may have a partner here with you too.
Yes. Well, Jim, let's break for a commercial, then we'll be back to wrap things up. Welcome back to Modern Medicine. We are about to conclude our presentation on narcotics as a killer in Schuylkill County and Northeast Pennsylvania. Our guest is Mr. Jim Nettles. And before we went to break, Jim, we were talking about the problem or the craving that these heroin addicts develop for sugars, and again, leads to poor oral hygiene and bad teeth, basically. But you have some photographs of the ravages of this.
Yes, I do. This photo here just basically shows what the destruction of the teeth in the mouth of this individual from the increased use of the drug, and you can see that missing teeth, and the teeth are basically
Just
almost not usable.
not usable. Yeah.
And also, as a heroin as a narcotic, they have like four main characteristics. And analgesic basically kills pain. The one basically induces sleep, drowsiness and sleep. You have a dependency for both physical and psychological. And then you have this euphoria, basically a feeling of well-being and tranquility when this drug particular, enters into the body.
And, from a medical standpoint, many of those characteristics are useful, and we could treat patients with them. Others, totally destructive.
And as you know, heroin is basically a derivative of opiates, different forms. You have pure, less pure. Less pure, your shade of browns, Some of it's cut with cocoa powder or face powder. And so you never know what you're going to get inside of these. And the pure is basically, it's white.
The young people have to be cognizant of what they could be injecting into their veins. And again, these are all foreign substances, and they get pumped throughout the body. But if they get this lodged on your heart valves and leads to an endocarditis or an infection, that's only about a gram of tissue, but it's a critical gram. And if it gets destroyed and a hole develops in the valve, your heart's going to be destroyed.
Just from an injection.
Endocarditis, yeah.
And another thing is that the number of people basically who use and fatally overdose on heroin has basically skyrocketed, not only in Schuylkill County, but heroin that is spiked that we're talking about with fentanyl. In Pennsylvania, just in January 2014, we had 22 people died after injecting doses of heroin contaminated with fentanyl.
Nothing short of an epidemic, really.
And Northeast PA, particular problem, our problem is that with heroin is our proximity to some of these large cities. For example, the distribution centers of New York, New Jersey, and Philadelphia. So we have all this drug coming from various locations. And some facts is that in 2010, there's 3,038 overdose deaths. Between 2002 and 2010, the number of people using grew from 400,000 to 600,000.
And this in the nation as a whole.
In the nation as a whole. And another fact, that this is kind of a sad fact here involving children, is that more children were forced into foster care due to addicted parents. And as a result of that, our foster care system is going up.
Getting overloaded.
Getting overloaded.
Yeah.
And basically, again, with heroin found in fentanyl, it is driven a major increase in property crimes, which we were talking about before. Increase in shoplifting, rings to raise money to buy their fixes, burglaries, home invasions are up for the last 5 years, and more homicides in which drugs are just motive. And I believe we're just talking about one in the county recently.
Yes, I remember that well, and they were people from Philadelphia.
Yes.
Yeah.
And another important problem with our what we need to get together with is the product logos. It's very important that we keep a track of where they're coming from. And every
Jim,
deal,
we just called upon your expertise to have some little baggies that were found at a possible overdose scene. And there were all kinds of names on them. Can you tell us what that's about? Apple and
right. Well, basically, every dealer wants to advertise their product, and with the logo, and they want the best product out there. And as a result, the investigators need to search the scene for these baggies. They may not be at the scene. They could be in a pocket, trash can, or wherever.
out in the dumpster outside.
Outside. The logo is important due to the fact it will give the investigators a location where the drug came from. And a lot of things when you do have this information should be placed, I think, in a central file, that all investigative agencies should know where this drug is coming from, and what corridor they're coming from. It helps with the investigation of drug activity. And a lot of police departments may take these baggies and put them in an evidence bag and leave them there.
Yes.
There's a lot of evidence to them. I understand it's time consuming. The baggies should be sent to the PSP lab or another lab, do for fingerprintings. And also testing some of the ingredients, because some of the minute ingredients that are in the bag can also help you with your investigations. And you'll be surprised sometimes with the baggies what fingerprints you can pick up. And it does help with your putting a case together.
Well, Jim, we would certainly love to cooperate with you and the other investigators in the county in that regard, because again, if we can nail somebody that led to the death of this person, that will make it all worthwhile.
Sometimes a simple fingerprint can solve a case. And I just give you some examples of logos, what you mentioned: Apple, Thumbs Up, Bud Light, Thermofuel, income tax. A lot of these have already been tested positive for fentanyl. That information there basically came from New Jersey. Dealers put so-called stamps in their bags to allow users to basically choose between their different patches to know some of the patches may have this on it, and some of the patches means different things. And it's important for the investigators to know that.
Didn't you say they often take pride in their product?
They definitely do.
Yeah.
And that is something that you can trace back. Remember this, when you have a contact with heroin, remember that fentanyl, as you well know, doctor, can be absorbed through the skin and can be administered in the form of a patch, which you talked about, a drip or a lollipop. And users don't know how much fentanyl is basically into these. And as a result, a small amount can be fatal. And dealers would push their product as being a super high. They want to get that best product out there. And as a result, that's why we're having more deaths, because of they keep pushing their product as the best, and to go back and forth, they want that fentanyl.
Jim, just to summarize, what would your recommendations be to our viewers on how they can assist law enforcement to try to contain this epidemic?
Well, basically, there's a lot of people out there that have information. They need to share that information with law enforcement. Whatever information they have, whether it's suspicious activities that they see at a home, pass it on to the police departments or your drug task force, and let these agencies know that, or if you see someone that you recognized, as we did in the picture, and all of a sudden you see him and you know that this individual has a problem, pass that on.
Yeah.
Pass that on.
Well, we thank you for watching Modern Medicine. Our special guest today, Jim Nettles, who has provided us with much knowledge and information regarding the drug epidemic that's facing Northeast Pennsylvania. Thank you, and hope to see you soon for other programs. Thank you.